The UCLA Center for Health Policy Research seeks to advance the health and well-being of all people through the development and dissemination of data that accurately represents their lived experiences. At the core of the mission is the goal to democratize data, to ensure that it is available to people who can use the data, to communities who need the data the most.
That was one of the key visions of our founder, Dr. E. Richard Brown, and it's something that we've held very close to our hearts and minds as we release data.
We have freely available lookup tools on the web. We have freely available public use files for researchers that want to do their own statistical analysis.
The center is administered through the UCLA Fielding School of Public Health, and it's staffed by faculty, researchers.
We all share a great mission, which is to improve the health of Californians.
We conduct surveys in several languages.
And this is an opportunity through the data we generate to give voice to those who haven't had a voice.
We provide technical assistance, training, and resources to organizations free of charge to help them improve their own data so that they can ensure that it represents the communities that they're trying to serve.
We do that through a number of different tools. Some are as easy as a click of a mouse, like our AskCHIS data platform. Others are more powerful tools, like our public use files and Data Access Center, which really enable in-depth research into the very powerful data-enriched resources that we have here.
We lean and appreciate communities that have collaborated with us in guiding us and asking, what are the right questions? What are the emerging issues that they're seeing frontline?
As part of the World Health Organization, I've been leading our work on aging and health. We put together a major global report, and the center contributed to that report. Their approach to looking at multi-sectoral solutions to improve the health of populations is really important, and I think that stands out.
We lead the nation's largest state health survey. The survey has become a model for other surveys in the United States, including federal surveys on how to be inclusive. We also have gotten the Inclusive Voices Award from the American Association of Public Opinion Research. We were the first to talk about data equity, the first to share what we were learning on data equity.
We see that the work that we're doing gets turned into policy. So that is perhaps the most rewarding aspect of the work that we're doing here and keeps us going.
I think one of the strengths that the center has is in the diversity of perspectives that the staff, the researchers, everybody who works here on various teams bring to the work every day. We have access to an incredibly talented group of students who come through the School of Public Health, but also through other schools and departments at UCLA. We work with various funders from federal to state to local. A lot of philanthropic foundations also are critically important. We can't do the work without that financial support.
We certainly benefit from the wonderful support and infrastructure we have at UCLA, but we wouldn't be here without our funders and our partners.